Hi, I'm Dr. Katie Deming, and in this video I'm going to talk about the role of whole breast radiation for DCIS. Now, DCIS is a pre-invasive type of breast cancer. We call it stage 0 breast cancer, but DCIS just means that those abnormal cells are confined to the ducts, so ductal carcinoma in situ. In situ just means confined to the ducts, and that it by definition does not spread to the lymph nodes or other parts of your body. So this is considered a localized condition to the breast, but we treat it much like breast cancer. And the reason why is the thought is that DCIS over time can evolve into breast cancer, although there's some debate in this regard, but we do know that DCIS, when it's removed, it can come back. And when it comes back, half of the time it comes back as an invasive breast cancer. And that's really what we're trying to avoid, is this invasive breast cancer. The DCIS is actually in and of itself not going to hurt you. So many women will have a lumpectomy as their first step in the management of DCIS. And the lumpectomy removes the area of DCIS, and the goal is to get clear margins all the way around the DCIS in the breast tissue. The goal for your margins actually for DCIS is 2 millimeters. And this is bigger than the margins we require for invasive breast cancer. And sometimes actually this is confusing for people because they're like, well, why for invasive breast cancer can I have like a margin of 0.1 millimeter and it be acceptable, but not for DCIS? And the best way that I can describe this is that DCIS often causes a field effect in the breast, meaning it causes an effect in a wider area of the breast than just a tumor. Invasive ductal carcinoma, when it develops, often develops as a little tumor and it grows, and either you see that on mammogram or you feel it. With DCIS, what happens is you get these kind of abnormal cells that develop in an area of the breast or sometimes throughout the breast. And the best way that I can describe the way it appears in the breast is it's almost like you've dipped a paintbrush in paint, and then you've flicked it like this and splatter the paint on the wall. That's the way that DCIS shows up in the breast. So you'll see it in little kind of splattered and disparate areas, rather than just like this like single clump like an invasive breast cancer would show up. So when we get our margins on your surgery for DCIS, we want to get at least 2 millimeters so that in case there's like another one of those little splatters that's just outside. So that's the margin status in terms of the DCIS. We want to see at least 2 millimeter margins. But even when you have negative margins, oftentimes radiation is recommended. So let's dive into that. The reason why is because when you remove DCIS with a lumpectomy alone, the risk of recurrence is about 30%. And this is taking all comers. So this is low grade, high grade, young, old, all everyone who has DCIS. Overall, the risk of recurrence after lumpectomy is 30%. And radiation reduces that by half. So from 30% down to 15%. And that's why radiation is used, is to reduce that risk of recurrence. Now, you heard me say before that we're really worried about the invasive recurrence rather than DCIS. So if you think about that, the risk of the recurrence overall is 30%, but only half of those are invasive. And the radiation reduces that risk by half. So your risk of developing an invasive breast cancer after lumpectomy for DCIS is 15%. That's the invasive component. And radiation reduces that down to 7.5%. So that's acceptable. And that's really why we're using the radiation, is to sterilize those cells that may be left behind, because we know that 30% of the time the DCIS is going to come back. And we're trying to reduce that risk, that overall risk, and specifically the risk of it developing into an invasive breast cancer. Now, there are some caveats to this. There are some indications that some women can omit radiation as part of their treatment. And there are some tests that can be done to determine whether or not radiation would be of benefit or not. The criteria that I would say, if you have these things, you know that you need radiation. That's what I'm going to go through this in this video, and then I'll do a separate video on who might be able to omit DCIS. Omit radiation for DCIS. But women who absolutely are going to need radiation after surgery for DCIS are high-grade tumors. So DCIS that has a high grade, and sometimes it'll be qualified as grade 3. But grade is just how the tumor looks under the microscope. A low grade DCIS is one that looks like it's growing slowly. It's not likely to do bad things over time. Intermediate grade is kind of in between, and then high grade is something that looks aggressive, that if it were to come back and it were to become an invasive breast cancer, it was aggressive and we're worried about it doing bad things like spreading to lymph nodes or other organs. Okay, so the grade is really how does it look under the microscope, and we use those features of how it looks to determine what its behavior might be. It doesn't say what it's done at this point, it just tells us what the cells look like under the microscope. So that's one factor. If you have high grade DCIS, you absolutely need radiation. I can't think of a circumstance where we omit radiation for high grade DCIS. The other thing is that if your tumor is bigger than 2.5 centimeters, the data suggests that you need radiation as part of your treatment. I would say in general, young women, we worry about risk of DCIS in young women, but that's not an absolute. But in general, if you're younger than 50, we're often going to recommend the radiation as part of your treatment. And then the margins. So your margins need to be at least 3 millimeters to consider avoiding radiation. So if you have margins that are less than 3 millimeters, radiation is most likely going to be recommended as part of your treatment. Another thing that we factor in there is necrosis. So necrosis is just dead tissue in the specimen, and that tends to be associated with a high-grade DCIS. And then one other thing is ERPR negative DCIS tends to be a little bit more aggressive, and that may be, it typically goes hand in hand with grade 3, but that may be something where your doctor is pushed more towards offering radiation. I will do another video about people who could potentially avoid radiation and some of the tests that we use to determine that. So check that video out. But if you liked this, if this was helpful, please like this video. Please comment below if it was helpful and what other information you'd like to know. And then also please subscribe to my channel. Thanks so much.